Do you wonder if your child might need tubes in their ears? I'm Dr. Tracy Tyson, board certified general pediatrician. Let's talk about when your child might need tubes in their ears for chronic recurrent ear infections. So this has changed in the last 10 years, and a lot of us are struggling to keep up with it. So let's talk about it. First of all, about 10 years ago, we had very different guidelines, and that stated that if a child had more than 3 ear infections within 6 months or more than 6 ear infections within a year, they likely needed tubes in their ears to drain the infection out the front because the child might likely have more serious complications or hearing loss. But as the Hib and Prevnar vaccinations became even more prevalent and worked better and better, we saw the rate of significant ear infections drop dramatically. And with that, we've changed our guidelines with when a child might need tubes in their ears. So here's something to understand. There's 3 main bacteria that cause ear infections: strep pneumonia, Haemophilus influenza, and Moraxella catarrhalis. 2 of those are now mostly prevented by vaccination. So we really only have Moraxella left and a little bit of strep pneumonia and Haemophilus influenza, but much less prevalent. Most ear infections are viral, meaning that they're unlikely to cause significant complications such as infection behind the ear, abscesses in the brain. They're unlikely to cause those serious complications. Therefore, really the only thing left is chronic pain in a child and hearing loss. So that's why when you talk to your doctor these days, they're less likely to send you to ear, nose, and throat doctor because likely ear infections are going to get better on their own. So why would your child need the ear tubes? And that would be 2 reasons. If your child has any hearing loss or balance problems because of the middle ear fluid in their ear. Remember, ear infections are a plumbing problem. They're not an infection problem. Then we need to drain out the front of the ear so that the child can recover their hearing in most cases and get their balance back. The other reason would be if after 3 months, the fluid in the middle ear will not go away on its own. So if you see the ear, nose, and throat provider, they look in the ears, they do some testing, and there's still fluid in the middle ear after 3 straight months, they might recommend tubes at that time. So this is different than it used to be. I get this question a ton in clinic. If you guys have any questions about ear tubes or ear infections, let me know. Take care.